My name is Shannon Mullally, and I will be your moderator today. I'm so excited to be here. My daughter received a kidney transplant in 2020 when she was 4, and my husband donated as well. Through the transplant process, we have had countless, if not thousands, of port draws and lab draws. And so I'm really excited that both Courtney and Ashley are here today to present such important information and helpful information for us caretakers. So let's go ahead and introduce our guests of honor today. We are joined today through 2 wonderful women from the Boston Children's Hospital Solid Organ Transplant Department and the Complex Surgical Unit. We have Courtney and Ashley. They are certified child life specialists. And Courtney and Ashley, the floor is yours.
Thank you so much. Hi, I'm Courtney.
And I'm Ashley. Thank you so much for having us today. We are so excited to be here. As was shared, Courtney and I are the child life specialists on Boston Children's Inpatient Solid Organ Transplant and Complex Surgical Unit.
So POCs are a daily occurrence, and we wanted to share what we have found most effective in our practice when helping patients and families with needle-related procedures. Getting a POC can be scary and hard for anyone, regardless of their age. And caregivers often come to us and share how challenging it is when they feel blamed by their child. And we want to take a moment and emphasize that you're your child's safe person. And we hope that this presentation empowers you to advocate and truly feel like a person on your child's team, as well as provide you with some strategies to make these hard moments an opportunity to practice successful coping strategies.
At the core, the role of a child life specialist is to validate fears, support coping, and ultimately minimize medical trauma. As developmental experts, we know that the way language is presented to a child can greatly impact the way they process that information and their reactions to it as well, including their trust in the person and their sense of self and their sense of confidence in what's about to happen. So on the screen today, we have some helpful phrases when navigating blood draws and other needle-related procedures. I want to draw your attention to the first column, where I'm going to highlight 2 that we really prioritize using in our practice and modeling for families. The first one, I understand that this feels hard or scary, but we're going to get through it together. So the power of this phrase is that you're naming the challenge. In doing so, your child will recognize your acknowledgement and your concern. They'll see that this is not your choice either. If you could take away this option, you would. So you're showing them that you're there on their team and you're going to get through that procedure together. At the bottom of the pink column is crying is coping. And this is my personal favorite mantra. So by encouraging a child to release tears when appropriate, a genuine release of emotion happens, and you're acknowledging that listening to their body is valid and important. Often there's really good intention behind saying, don't cry, it's okay, stop crying, but you're actually minimizing those feelings and forcing them to also be self-conscious of not only their genuine fear or anxiety, but also their response to that genuine feeling. We never want patients, regardless of any age, to feel ashamed of tears. So crying is coping.
And then the tourniquet, some helpful phrases. So the tourniquet is often the part in the lab draw where fear sets in because of the noticeable discomfort. And these phrases on the blue square help convey that the stretchy band can be playful and invites children to contribute their own opinions. Play and independence are important aspects of establishing a sense of control over one's environment. So then the needle, and this is the point in the procedure where we can see anxieties, fears, or phobias, but relating the needle to something less fearful and more common, like a straw or a butterfly, certainly lessens the intensity associated with it, and it also provides to be a helpful visual.
I'm just going to leave this up for another moment so everyone can take it in since we forgot to share.
So a successful blood draw consists of 4 parts: the use of child-friendly language, appropriate preparation, an action plan, and emotional support. On the screen, we have some of our preferred descriptive words alongside phrases that we avoid when talking about needle-related procedures. When talking to your children about a procedure, it's often helpful to inform them of the tools and resources they have choices over. Some of the items we have listed are for pain management, like EMLA. And EMLA is a numbing cream that can be applied to the skin 15 to 30 minutes before the procedure and just requires a prescription. Another choice is the Buzzy, which is the vibration device that is placed on the skin. And what it does is split the neural pathways in half, so only half of the nerves detect some pain. And then some families often find it helpful to put a countdown timer on their phone because it indicates that the poke is not a choice, but provides a visual of when it will be happening. And then in the next few slides, we'll talk about comfort positions and medical play.
So on the screen, we have highlighted 4 different comfort positions that we advocate for the use of daily. By physically holding or sitting with your child, you're providing positive touch, which calms the nervous system and offers a sense of security and safety. As you can see, there's chest to chest, back to chest, a side sitting format, and a cradle hold for an infant. Easing into a comfort hold can also assist in easing into the transition of the procedure. You are never too old for a comfort hold. Many of the school-age kids and adolescents actually benefit from an adaptive side hug. And there are other procedures that this is relevant for too. You can use comfort holds for dressing changes. We actually really love the back to chest for toddlers for IM injections or vaccinations. And the power is huge. I mean, just like a weighted blanket, that security of someone holding you comfortably opposed to restraining you makes a huge difference in coping and regulation and decreasing anxiety within the body. So we've also provided you with this PDF that I think you'll get at some point to reference later.
We know that getting a blood draw is out of your control, but the preparation and advocacy are areas you can aid with. We've outlined some of the resources already, like EMLA and Buzzy, but here are additional reasoning behind some of these bullet points. So hydration and heat make the veins more visible. Preparation offers a sense of mastery, and comfort positions, just like Ashley said, offers feelings of safety. And then pain management, we've discussed EMLA. There's also sucrose, which is for patients 6 months and under. And the purpose is to provide sugar water while the needle is happening to counteract and cause a more pleasant experience. And then gauze or a t-shirt under the tourniquet makes it sting less or be bothersome on the skin. And then finally, if appropriate for your child, you can work together to make a coping plan, which happens to be one of our favorite things in our practice.
So what is a coping plan, you ask? The coping plan outlines what is most helpful for the team to know for a child during a needle-related procedure. So this plan might start out as a conversation with an older child or a sense of trial and error among caregiver and patient of a younger age. So if appropriate, the children can actually help design their own individualized plan, which helps provide them a sense of mastery and control over their unavoidable procedure. So as you can see on the screen, this is one example of one that can be filled out day of, and it might, allow the child to say, hey, this is what I anticipate I might be feeling like today. And it also allows them to change it day to day, to change their mind, to really be that master over their experience. So these can vary day to day. They might be a strict thing that you bring to every single clinic visit, every single inpatient visit, and you know that this is what works for your child. So this is actually also going to be attached as a PDF for y'all, but Courtney's going to talk a little bit about some specific ones we use inpatient. Oh no, I skipped ahead.
So here are examples of additional poke plans, and we just wanted to highlight how personalized these signs are. And on the pink poke plan, I wanted to touch base about the first bullet point that says, I do best when only mom is talking to me. And we want to highlight how overwhelming it can be when many individuals are in the room praising or even redirecting the child. But if you feel as though your child responds best to your voice, advocate to be the one voice in the room. And we also know that can feel hard, but a helpful phrase that we like to use is, there's a lot of people in here and that can feel overwhelming. All I need you to do is listen to my voice. With that being said, it's equally important that you exhibit a calm energy, as children often match their caregiver's presentation.
So in addition to poke plans, a step-by-step chart can be really beneficial for all children, but especially for patients with autism spectrum disorder or other developmental delays, or really any kiddo that benefits from concrete, accurate visual representations and predictability. So in this step-by-step chart, patients have the option to move the picture along from the to-do to the all done throughout the process of the procedure. And then that helps them have a sense of accomplishment after it as well, when you can really celebrate, look at every single step you accomplished. You did it.
Medical play is another wonderful way to offer control to patients prior to a blood draw. In the child life profession, we talk about role reversal, where the child has the opportunity to be responsible for leading the procedure, often which they've been on the other side of before. And here during medical play, we may even see a glimpse of the child's coping strategies, perhaps by telling the doll, it's okay to cry, take a deep breath, I'm here to hold my hand.
So one of our hot topics today is we are frequently asked by parents when it is appropriate to go straight to the IV team. So as a general disclaimer, every hospital policy is different, but what we've gathered is exhibited here as when it's important to consider when you might be asking to go directly for the IV team. So at Boston Children's Hospital, the IV team is paged after 2 failed attempts by phlebotomy. We encourage you to inquire about the policy at your hospital or clinic before deciding to do more. But some things to consider is, as your child usually result in 2+ pokes anyways, we want to minimize pokes for all kids, no matter how they cope with them. And is your child already anticipating needing an IV placed during that day? That is a completely reasonable request. If you're already going to get an IV placed, there's no need to be stuck more than once. Some things we like to remind parents of, especially for younger children or kids that are just starting the transplant journey, is that when asking for an IV, there is additional equipment that is used, the ultrasound machine consisting of the camera and the jelly. So that is some more sensory things to consider, additional prep to consider. And additionally, when you page IV team, you might be waiting a while. So is your anxiety really high? Is your child's anxiety really high? Are you waiting on a level to determine some medication? That might delay a clinic visit. That might extend your time at the hospital or the waiting room. We always encourage families to do what is best for their child. And we have seen some kids that, phlebotomy doesn't even stop by. They are an IV kiddo. It's on the rarer side here at Children's, but we want to share that to normalize it too. It's worth considering and talking with your healthcare team about what's best for your kid.
And then another question is it okay to reward after? And there is no right or wrong answer, as you know your child best. But what we urge you to think about is this something, or is the reward system sustainable long-term? So sometimes we do find it helpful to reward, and that would be if it feels sustainable, if it's extremely motivating to the child, we're confident that we can end the prizes, and if it's necessary to redirect a substantially challenging event. But on the other hand, there's other options instead of tangible rewards, such as verbal praise and stickers, dance parties. It could be a special trip to a place. Sometimes in the hospital, it's a visit to the fish tank or the gift shop, but nothing needs to be purchased. So whether you choose to reward or not to reward is up to you. But one of the most important things that you can do is emphasize the quality that your child exhibited, whether it was their bravery, their kind words, their safe body, their strength, their perseverance. during something hard, and they were able to keep their body healthy and safe. And then sometimes, despite all your preparation and advocacy, it's just really hard. And we understand that and want to normalize that as well. And so what we emphasize is the return to baseline. And that is characterized by a child's ability to return to normal breathing, the ability to engage in play, vocalize their needs, and demonstrate other temperament behaviors.
We share this because the medical team, unfortunately, and fortunately, will be sure to get a successful blood draw if necessary, and that can be hard to witness under certain circumstances. It's essential to keep your child healthy. In these situations, it's often common to feel defeated, and we don't want to minimize that feeling. It's natural as a caregiver, but we want to recognize the power that you have in aiding your child's return to baseline to their typical presentation. A return to baseline, which demonstrates healthy coping, is crucial and often an overlooked part of minimizing medical trauma. You are their biggest comfort, advocate, and resource. And with that, we open the floor to questions. We can revisit slides that y'all missed or take some time to answer.
Thank you so much. So we had two great questions pop up while you two were presenting. We have one that says, is EMLA just something we should ask our teams for? I've never heard of that before, but would love to try it. And that was from Stephanie Mullet.
Yes, I believe EMLA is not an over-the-counter prescription, but a prescription that can be picked up over the counter. It's definitely worth asking your team for. There's other brands too. There's EMLA and begins with an L.
It's going to come to me in a couple of minutes.
Lidocaine.
Lidocaine, thank you. But absolutely, it's just a numbing cream. They use it for port accesses frequently too. It can be applied anywhere from 10 minutes to an hour before a poke. We just put a little Tegaderm over it to keep the lotion in place, and then you wipe it right off, and it is a numbing cream, and it makes a huge difference for a lot of kids.
And then just to take that a step further, something that you can also offer to your child is have them put the EMLA on, because again, we're giving them a sense of control when they can have a sense of control. So that's just another idea.
Earlier this year, Courtney and I actually rolled out a new needle pain protocol for our inpatient unit. So it actually asks every nurse to reflect on what pain management is available for each age group. So for our preschool and school age kids, in adolescents as well, it is that EMLA cream or lidocaine. So now when kids have labs prescribed or ordered, the nurses really are responsible for ordering that and putting it on.
That's great. We have one more question that came through from Sarah Cashore. Her son, who was a BCH liver transplant recipient and has had great phlebotomists at BCH, thank you. He was transplanted about 8 months and he's 7 now. And thus far, he hasn't minded blood draws at all. And he doesn't really even remember life without them and doesn't seem to have any fear. We approach them just as a normal thing and often get a treat like we had just gone over since he's simply not eaten. So that may help too. For kids like him, transplanted very young, have you seen comfort with fear around blood draws as kids age and get older?
It's actually, it's a sign of their resilience. It's a sign of the normalcy. And I think you're doing everything exactly right. For kids that we know blood draws are going to become a daily practice, that's usually our advice to caregivers is to approach it very matter-of-factly. We have to do a blood draw today. If they're curious and want more information, then you can present it just like medicine or any other medical event. We have to do a blood draw to keep your body healthy. Your blood contains a lot of really important information that only the doctors can only find out about only you by looking at that blood under a microscope. So that's usually, I think you're doing great. That's awesome. I'm so glad your kiddo's doing great.
All right, and those were the only two that came in, but I have one additional one. Now, you guys spoke about a buzzy. Can you explain what that is and where families may find it? Because I know lots of parents, being a transplant mom myself, are always looking for what what could I buy? What is a fun little trick? So it sounds like a buzzy might be it. Can you explain that a little bit more?
Sure. I think we can tag team this one. Ashley's done actually a lot of research on the buzzy. But what it is it's in the shape of a bee. So it's the buzzy bee. And it's about this big. And what you do is you place it on the skin and it vibrates. And like I mentioned earlier, it splits the neural pathway. So there's only half detected pain. But this can be bought Amazon.
Most families have purchased it off of Amazon. They do have a direct website. It's like the Buzzy Bee. But yeah, as Courtney shared, it's the vibrating sensation provides a different input to your neural pathways. So it splits them. So it doesn't take away the pain, but it minimizes the perception of the pain. And for kids that can focus on it, it's also been a game changer. I mean, and then there's some kiddos that I've worked with that just love holding it. It's designed to be placed above the needle site, but just even holding it for some kids is enough of a sensory input that it distracts them away from focusing on the needle.
And along with holding it, we've also even found light spinners, because we know that buzzy can be expensive, but light spinners, which are also on Amazon, they have a vibration that can also be helpful and serve the same purpose.
Those are both great options. If we don't have any other questions, this is going to bring us to the end of our wonderful information of minimizing pain and maximizing coping with Ashley Eppolito and Courtney Jonas. Thank you so much, ladies, for sharing your time and your expertise with us today. I know us parents greatly appreciate it. And I do want to redirect you to the attendees. We do have an upcoming session right after this. It is going to be with Dr. Chaudhuri from Stanford Hospital, speaking about hypertension in pediatric transplant recipients. So make sure that's going to start in just a few minutes. So if you want to hop on over there, that'll be our next session. But please give a big virtual round of applause for our ladies, Ashley and Courtney. We appreciate you guys.
Thank you so much.
All right. Take care, everyone. Have a great afternoon.